In this video, we will discuss nutrition related to the life cycle stage of pregnancy. We begin our discussion of nutrition prior to getting pregnant. Key goals for a well-nourished mom include balanced nutrition, supplements, and hydration. Balanced nutrition emphasizes a diverse, balanced diet rich in the essential nutrients. This can be achieved by including a variety of fruits, vegetables, whole grains, lean proteins, and dairy each day. With supplementation, a daily vitamin should be introduced 1 to 3 months prior to getting pregnant, if that is possible. This will fill in the gaps to ensure the body receives all necessary vitamins and minerals. One of the most important nutrients prior to and throughout pregnancy is folate to support fetal neural tube development. The multivitamin should contain at least 400 micrograms of folate daily, starting at least 1 month prior to pregnancy and during the first 12 weeks of the pregnancy. Finally, adequate hydration is necessary for various bodily functions and promoting overall well-being. Prior to pregnancy, individuals should be encouraged to consume adequate water intake for proper hydration. In addition to nutrition, regular exercise is good to establish prior to pregnancy. Health practitioners should emphasize the importance of maintaining a physically active lifestyle and engaging in moderate intensity exercises such as walking or swimming to boost overall fitness. However, before initiating any exercise routine, we should recommend consulting with their physician to ensure compatibility with individual health conditions. Having a healthy overall lifestyle is key and involves avoiding harmful substances. It is good to start these healthy habits prior to getting pregnant and maintaining throughout the pregnancy. Women considering getting pregnant should stay away from harmful substances such as tobacco, alcohol, and illicit drugs. They can also minimize caffeine intake and consult healthcare providers for personalized advice. Weight prior to conception plays a role in the outcome of pregnancy. Underweight individuals are prone to preterm labor and low birth weight babies, which presents potential dangers for the baby. Individuals who are overweight or obese prior to pregnancy are more likely to have large babies, born late, C-section surgeries, pregnancy-induced high blood pressure, gestational diabetes, infections, and babies who are at risk of neural tube defects. Yet the obvious solution for these problems is for the individuals to work toward a healthy weight prior to getting pregnant. Unfortunately, it takes time to alter weight in a healthy way. Many may not want to wait. Think about how you would address an overweight or obese person who does not want to wait months or years to get pregnant. Pregnancy is a transformative journey with distinct critical periods, each playing a crucial role in fetal development. Understanding the critical periods of pregnancy is pivotal for safeguarding fetal development. Early pregnancy demands heightened attention due to potential irreversible impacts. As we see on the chart, the orange line represents an adverse influence early in pregnancy. The purple line represents normal, healthy development. Note that the fetus with early adverse problems does not fully recover by the end of the pregnancy. When adverse influences happen in the later stages, represented in the green line, recovery is possible. However, longer respiratory problems may still occur. Malnutrition is one of the adverse influences that negatively impact fetal growth. Proper nutrition before and during pregnancy is a cornerstone, mitigating risks such as poor dental health, neural tube defects, infections, and long-term health issues. This graphic better represents the development that occurs throughout the pregnancy. We can see several aspects of development with the central nervous system, heart, ears, eyes, limbs, teeth, palate, and genitalia. The pink represents the critical stages. If an adverse influence happens during these stages, it could cause permanent damage to that development. The brown or burgundy color represents continued development with much less risk for permanent damage. Notice that of these developmental areas, the critical stages happen in the first trimester. We often use the first trimester as the point at which risk of miscarriage and critical periods decline. The picture on this slide shows the difference in critical periods. The one on the left is showing how the neural tube has not closed yet at 4 weeks. But on the right, just 2 weeks later, it is completely closed. If an adverse influence like poor folate intake occurred prior to the 6 weeks, it may have never closed, resulting in spina bifida. Now let's switch gears and talk about what is needed once an individual gets pregnant to ensure healthy development of the growing embryo into a fetus. We talked earlier about how weight impacts the outcomes of a pregnancy. This still holds true once someone gets pregnant. If we can alter the amount of weight that a person gains based on how healthy their pre-pregnancy weight is, we are more likely to prevent all the complications we talked about earlier. Notice that someone starting out underweight prior to pregnancy should gain more weight than a person who starts out in a normal weight range. On the other hand, an overweight or obese person needs to gain less weight during pregnancy. The majority of the weight is gained in the last 2 trimesters. As you are preparing for the test, you will need to know the first 3 columns. You should have already learned the BMI categories, so it's only a matter of learning what the weight gain should be for each one. Based on the weight gain, we can determine the nutritional needs of a person. However, it is not just about weight. It is really about getting the right nutrients. An overweight or obese person still needs the same amount of vitamins and minerals, so they will need to focus more on nutrient-dense foods. As I mentioned, the weight gain primarily occurs in the 2nd and 3rd trimesters. Caloric intake should adjust accordingly. In the first trimester, there is no increase in the daily caloric intake. The 2nd trimester, which is the longest one, pregnant individuals should consume 340 calories above what their normal intake is. 340 calories is equivalent to about a half a sandwich with 2 ounces of chicken, lettuce and tomatoes, teaspoon of mayo, a glass of skim milk, and a whole apple. In the 3rd trimester, the calories increase to 450. Carbohydrate is critical to energy needs. Recall that the brain and central nervous system rely on carbohydrate almost exclusively. In absence of enough carbohydrate, ketones are used. Unfortunately, ketones can be damaging to a developing brain, so pregnancy is no time for low-carb diets. As a matter of fact, no-fat diets are recommended. Remember, more nutrients are needed to support the growth and development of a healthy baby. Diets promote reduced food intake and potential for low nutrients. Protein is necessary for the thousands and thousands of new cells being developed for this new life. There are several ways that it can be calculated, but they all equate to about 25 extra grams of protein per day. If we go back to the 340 calorie snack I suggested, notice I did not recommend a cup of Haagen-Dazs ice cream. I was very particular in the foods. 1 slice of bread equals 3 grams of protein, 2 ounces of chicken provides 14 grams, and a cup of milk provides 8 grams of protein. So when you add that all up, we get 25 grams total of protein in their additional calories that they're consuming. Those foods are also rich in micronutrients necessary for development. Fatty acids, particularly omega-3 and omega-6, play a vital role in fetal brain and visual development. Incorporating sources like fish, flax seeds, and walnuts into the diet helps meet these essential fatty acid needs. While I know many may be concerned about the mercury in fish, it's not as bad as you think. It can be easily managed by avoiding certain types of fish found to be high in mercury. We will discuss that a little later. Folate is imperative for preventing neural tube defects, and pregnant women are advised to consume foods rich in folate, such as leafy greens, legumes, and fortified cereals. Vitamin B12 works with folate and is crucial for neurological development. It is found in animal products like meat, eggs, and dairy. For those following vegetarian or vegan diets, supplements or fortified foods become essential. Vitamin A is also essential. It is necessary for vision, immune function, and skin health. However, excessive intake can be harmful. Too much active form vitamin A can cause birth defects. Supplementation should be limited to minimal amounts below the DRI. Pregnant women are encouraged to obtain vitamin A as beta carotene from sources like sweet potatoes, carrots, and spinach, prioritizing beta carotene rich foods to mitigate the risk of toxicity. Continuing with some of the micronutrient needs, we should address the bone minerals, calcium, phosphorus, and magnesium. Calcium is vital for the formation of the baby's bones and teeth, and it also plays a crucial role in nerve function and blood clotting. Dairy products, leafy greens, and fortified plant-based milk are excellent sources of calcium. Phosphorus, found in foods like meat, dairy, and whole grains, is essential for bone health, energy metabolism, and cell formation. Magnesium, obtained from nut seeds, whole grains, and leafy greens, is crucial for muscle and nerve function, as well as the development of the baby's bones and teeth. Iron is essential for carrying oxygen and hemoglobin and myoglobin. It is also significant to the electron transport chain where ATP is produced. The problem with pregnancy is that cardiac output triples by the second trimester. The extra amounts of blood require extra iron. Thus, it is critical for individuals taking in higher amounts of iron to prevent maternal anemia and to support the baby's growth. Good sources include lean meats, legumes, and fortified cereals. However, many pregnant individuals are prescribed iron supplements by their doctor. Zinc is vital for immune function and DNA synthesis, and pregnant women can obtain it from sources like meat, dairy, nuts, and legumes. Maintaining a well-balanced diet rich in these nutrients is fundamental for a healthy pregnancy. Zinc deficiencies are associated with low birth weight babies, and high intakes of iron can interfere with zinc being absorbed. Knowing that iron supplements are common, zinc is a nutrient we should watch out for. One way that pregnant individuals can ensure adequate intake of all the micronutrients is by taking a prenatal supplement during pregnancy. These have increased amounts of folate, iron, and calcium, while only supplying 50% of the daily value for vitamin A. Consistent intake of prenatal supplements can help reduce the risk of preterm labor, low birth weight, and birth defects. One of our biggest problems with pregnant individuals obtaining all of their nutrients is a lack of adequate money to purchase their food. This country has an overabundance of processed foods that are cheap and easily accessible. The Special Supplemental Nutrition Program for Women, Infants, and Children, commonly known as WIC, is a federal assistance program in the United States that aims to improve the health of low-income pregnant women, new mothers, and young children. WIC provides nutritious food, nutrition education, and support to pregnant women and families with children under the age of 5 who are at nutritional risk. The program emphasizes the importance of early nutrition to ensure proper growth and development, addressing issues such as iron deficiency, inadequate prenatal care, and low birth weight. WIC plays a crucial role in promoting the overall well-being of vulnerable populations by offering access to essential resources and educational services to help families make healthy choices. It represents a significant effort to combat food insecurity and contribute to the long-term health of both mothers and their children. When someone qualifies for WIC, they receive food vouchers on a type of credit card. They are then able to purchase specific foods at a store. The foods allowed on WIC contain essential nutrients like iron, calcium, protein, and vitamins that are crucial for proper growth and development. You'll know which foods are allowed in stores by the WIC approved sign on the shelves. This is one of the best ways to educate families on how to spend their food dollars that can help them even after they don't qualify for WIC anymore. I always tell students that if they want to know the best foods to purchase, look for the WIC signs. These are the foods chosen by registered dietitians that provide the nutrients that are necessary for healthy families. Of course, we always have detrimental practices that must be avoided during pregnancy. Alcohol should not be consumed at all throughout pregnancy, as there is a risk of fetal alcohol syndrome, and that can lead to both physical and cognitive developmental delays. Smoking should not occur at all. That leads to low birth weight babies. Drugs, we have two different categories here. No illicit drugs, period. Prescription and over-the-counter medications should be approved by the doctor. Caffeine is in moderate amounts considered to be okay. Sugar substitutes, once again in moderation, are considered to be okay. Poor dental health is not okay. The bacteria that that are prominent in the mouth when you don't take care of your teeth can cause early contractions. Therefore, it becomes even more important for pregnant individuals to brush and floss daily. Consuming fish is generally considered a healthy dietary choice, but it's crucial to be mindful of mercury levels, as high exposure can pose risks, particularly for pregnant individuals and young children. Certain types of fish, such as shark, king mackerel, tilefish, and swordfish, are known to accumulate higher levels of mercury. To minimize mercury intake, it is recommended to avoid these species altogether. Additionally, when including white albacore tuna in the diet, it's advisable to limit that consumption to just 6 ounces per week due to its high mercury content. For the other fish varieties, a prudent approach involves limiting intake to 12 ounces per week. These guidelines are essential for maintaining the health benefits of fish consumption while mitigating potential risks associated with mercury exposure. Here you will see a list of fish that are best choices, good choices, and then the ones to avoid. Please feel free to pause the video on this slide to get a better view of the fish choices. During pregnancy, practicing food safety is of utmost importance to protect both mother and the developing fetus from potential risks, including foodborne illnesses like listeriosis. Expectant mothers should be vigilant in avoiding certain high-risk foods to minimize the risk of infection. This involves steering clear of unpasteurized juices and dairy products, as they may contain harmful bacteria. Soft cheeses such as feta and brie, which may harbor Listeria monocytogenes, should be omitted from the diet. Additionally, caution is advised when it comes to cold luncheon meats and hot dogs, as they can carry the risk of listeriosis as well. Ensuring the thorough cooking of all meat, poultry, eggs, and seafood is crucial to eliminate any pathogens. Furthermore, washing all fruits and vegetables before consumption helps reduce the likelihood of contamination. By adhering to these dietary precautions, expectant mothers can safeguard their health and the well-being of their unborn child during this critical period. In addition to the lifestyle and food practices that can have negative consequences, several nutrition-related concerns are inherent in pregnancy. Food cravings, aversions, nausea, vomiting, and heartburn can promote unhealthy eating habits. Additionally, constipation can present uncomfortable symptoms that require fiber and fluid to help prevent. Gestational diabetes occurs frequently in pregnancy that causes potential problems for mom and baby if blood sugars are not managed. Finally, pica can occur with iron deficiency. While cravings are normal due to hormonal changes, pica is a much more serious type of craving. Pica is a disorder characterized by the persistent craving and eating of non-nutritive, non-food substances. People with pica may crave and consume items such as ice, clay, soil, hair, wool, paper, soap, metal, pebbles, chalk, charcoal, ash, starch, gum, talcum powder, paint, gum, mucus, or latex. And it's more common in pregnant women. The specific cravings can vary widely and may depend on cultural and individual factors. Pica is often associated with nutrient deficiencies such as iron deficiency, and it can be particularly concerning during pregnancy due to the potential harm to both the mother and developing fetus. If someone is experiencing symptoms of pica, it is crucial for them to seek medical attention to address underlying health issues and nutritional deficiencies. Towards the end of pregnancy, it is important for a pregnant individual to consider how they will provide nutrition to the baby once it's born. Breastfeeding is one of the options. The American Academy of Pediatrics and many other health organizations recommend breastfeeding as the optimal source of nutrition for infants, promoting its numerous health benefits. Exclusive breastfeeding, meaning providing only breast milk without any other liquids or solids, is advised for the first 6 months of a baby's life. This exclusive breastfeeding phase supports optimal growth, development, and immune system function. Continuing breastfeeding alongside complementary food is recommended for at least the first year of an infant's life. Breast milk provides essential nutrients, antibodies, and tailored support for a baby's developing immune system. It fosters a unique bonding experience between the mother and child while contributing to the overall health and well-being of the infant. Therefore, healthcare professionals encourage mothers to embrace and sustain breastfeeding practices for the initial critical stages of their baby's life. Breastfeeding offers a multitude of benefits that extend beyond basic nutrition. Emotionally, it fosters a strong bond between parent and baby, promoting a sense of security and comfort. In terms of digestion and absorption, breast milk is easily digestible, reducing the likelihood of digestive issues in the infant. It also supports cognitive development, as breast milk contains essential fatty acids crucial for brain development. The immune factors present in breast milk contribute to the baby's developing immune system, offering protection against infections and diseases. Additionally, breastfeeding is convenient, providing a readily available, temperature-adjusted, sterile source of nutrition without the need for preparation. These collective advantages underscore the holistic impact of breastfeeding on the physical, emotional, and cognitive well-being of the infant. Breastfeeding holds several advantages for health. Colostrum, which is the initial milk produced after the baby is born, contains the highest concentration of antibodies, offering crucial immune support during the early days of life. Breast milk is rich in essential nutrients, providing an ideal balance for the baby's growth and development. Its higher fat content compared to formula aids in the development of the infant's brain and nervous system. Moreover, breast milk contains proteins that are easier to digest and play a vital role in bolstering the baby's immunity. However, it's worth noting that breast milk may lack sufficient vitamin D, and supplementation or exposure to sunlight may be recommended to meet the baby's vitamin D needs. A medical provider will be able to make those recommendations for a newborn. Overall, breastfeeding stands as a comprehensive source of nutrition uniquely tailored to support an individual's overall health and well-being. Breastfeeding brings numerous benefits, but certain concerns require attention to ensure both maternal and infant well-being. Nutritional deficiencies in the mother's diet can potentially impact breast milk quality. Breast milk has the remarkable ability to prioritize the baby's nutrient needs, potentially leaving the mother deficient. In cases of poor dietary intakes, recommending supplements becomes crucial to maintain optimal nutrition for both the mother and the baby. Supplementation suggestions, as well as guidance from programs like WIC, can provide valuable support. Moreover, adherence to mercury recommendations is essential, urging mothers to avoid high mercury sources, but incorporating high omega-3, low mercury fish at least 2 to 3 times per week to benefit both parties. When it comes to alcohol consumption, moderation is key. Mothers are advised not to exceed 1 drink and and wait at least 2 hours before breastfeeding to minimize potential negative effects on the infant. Addressing these concerns ensures a balanced and healthy breastfeeding experience for both mothers and their babies.